afternoon, everyone. Bonjour à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. My name is Kina Leclerc, and I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de ce point de presse. Before we begin, a quick reminder to place your phone on mute until I invite you to speak or to ask your question. And please do not place the call on hold. Available for questions from the media, we have, disponible pour répondre aux questions des médias, nous accueillons in Council Chambers, Mayor Le Maire Jim Watson, Steve Kanellakos, City Manager, Directeur Municipal, and Anthony DiMonte, General Manager of Emergency and Protective Services, Directeur Général des Services de Protection et d'Urgence. Phoning in today, we have la Docteure Vera Etches, Medical Officer of Health, Médecin-Chef en Santé Publique, Dr. Trevor Arneson, Associate Medical Officer of Health, Ottawa Public Health, Médecin adjoint en Santé Publique Ottawa, Donna Gray, General Manager, Community and Social Services, Directrice Générale des Services sociaux et communautaires, and members from her team, ainsi que plusieurs membres de son équipe. We also have John Manconi, General Manager, Transportation Services, Directeur Général des Services du Transport en commun, as well as members from his team, ainsi que plusieurs membres de son équipe. Phoning in, we also have Wendy Stephenson, Chief Medical Officer, Chef des Finances, and Isabel Jasmine, Deputy City Treasurer, Trésorière municipale adjointe. We also have Marie-Claude Turcotte, Manager of Immunization at Ottawa Public Health, Gestionnaire d'immunisation, Santé publique Ottawa. I will now invite each agency to ask their question. You may ask one question with one follow-up. Par ordre alphabétique, j'invite maintenant chaque organisme à poser une question et une question de suivi. If for some reason we lose you during the call, please try phoning in again or contact media to submit your question. Si nous rencontrons des problèmes techniques, veuillez s'il vous plaît contacter les relations médias pour envoyer.
If for some reason we lose you during a call, contact media.
Who do we have on the line?
S'il n'y a personne d'autre, il y a une accès à libérer.
I pressed the wrong button. It's Kate, Kina.
Kate.
Thanks. Perhaps this is a question for Donna Gray. I see the province has announced another several hundred million for shelter and COVID today and about 22 million or so for Ottawa. I wonder, what do you see as the most pressing needs for that money and what you most hope it be used for?
Thank you very much. Yeah, we're really excited to see the province's commitment to their next installment of the Social Services Relief Fund, which has really been supporting our primary response through the Human Needs Task Force. And the priority is still, we're still in very much in outbreak mode, is to continue to have the supports for those individuals in our community most at risk. So that means the, continuation of our respite centers that have been really effective at providing space during the day for people who are experiencing kind of food insecurity or need washrooms and connections to services, and to support the shelters and the continued physical distancing centers that we have set up and the isolation capacity. We also have a network of support, community agency supports that have been supporting these services, but also been supporting our priority neighborhoods to make sure that those neighborhoods and communities continue to have the information that they need for both protection of residents, but also around vaccination. So I see those as the primary areas for funding. The need is still much greater than what the province has provided, but we're appreciative and thankful for the province's recognition of that continued need.
Yeah, Kate, if I could just, it's Jim Watson, just offer a quick comment to thank the province. This is something that we have been working on with local MPPs, and very pleased that they have come to the table with a significant amount of money, $22 million for Ottawa, because as you know, one of our most vulnerable populations dealing with COVID-19 are the homeless and those living in shelters. So my thanks to the province, en français, certainement.
I would like to thank the province of Ontario for their support. This will help us with our homeless population. This will help us support them. They are either living at Cornerstone or Shepherd's. And we have people responsible for them in these locations. So thank you very much for the support from the province of Ontario.
My second question is more directed to yourself, Mr. Mayor, and possibly Steve Kanalakis and John Manconi. And that's, were you aware in January about delays on the Trillium line?
Yeah, I normally get briefed, Kate, usually 3 or 4 days before committee meetings, and that was the case with this particular issue going into the in-camera session. I guess it was sometime last week. I lost track of the day. I think it was Tuesday, so it would have been 3 to 5 days before that. Thank you.
Thank you very much. We will now be going to Eric O'Brien at City News Ottawa.
Good afternoon, everyone. I guess my first question would probably be for Mr. DeMonte. You talked a little bit about policing around the byword for restaurant patios. Now, if we look to a little bit, before the pandemic with noise complaints for bars and other types of things, how do you think it would look this summer if patios are allowed to stay open and past 2?
Sorry, I don't think I completely understood your question, and I apologize. Could you just repeat it? You were coming in a little broken up.
Oh, yeah, sorry about that. So I just wanted to see how policing would, for patios, if they're allowed to stay open until 2, you talked a little bit about it at council, but I'd just like a little bit of elaboration on that.
So a couple of things. I mean, I think we're being very optimistic, and I hope that's true, that this summer we have a normal summer. We're getting back to normal. I mean, I want to remind everybody we're going to do 1 vaccine, and we're going to go through that quite quickly. But until we get a second vaccine, I think our medical officer of health and our health professionals will tell us that we probably won't be in a situation where we can reopen everything up as much as we thought. And I know there was talk about, Canada's Wonderland and that opening, and I really hope that's true. But I have my suspicions that may not be the reality. Now, that said, for the patios, we did, and the report was clear, there's an enforcement strategy with our partners in Pied. They've got a 3-strike thing. On the bylaw side of things, for noises, et cetera, we use our judgment and always try to intervene as rapidly as possible. The question of police, I think it was 2012 where police made a decision that calls with regards to noise complaint, the priority agency would be bylaw and regulatory services. Now, that said, whenever we have issues that there could be, difficulty to keeping the police respond rapidly to support us, but is not necessarily their prime response. Today at council, there were several councillors, including chair of public health board, that asked if I could go back to police, and I will. I'll be going back to our colleagues and see what better partnership we can do with them to be a little bit more present in the market if we do end up in the situation where things are opened up. And to be fair, last summer things went really well with police. They did step up and did some partnerships with us certain nights that we knew were problematic. So I'm very encouraged that when we go to them, they'll certainly be responding positively. Thank you.
Now, maybe my second question, just more generalized for Dr. Etches. You mentioned yesterday that there's certain COVID-19 indicators that you're really watching closely. Now, even Councillor Aguilar mentioned St. Paddy's Day that's coming up. What do you think impacts that we could see in Ottawa?
Well, we are continuing to stay in the provincial category of orange based on the key indicators of the rate in our community, but we are close to red. Always doesn't take much, and so it's the number of people testing positive per 100,000. It's about 36 today. Red is 40. There's also the percentage of people testing positive. So if we have more people who go for a test that are showing up as positive, that is important as a sign that there's more COVID in the community. And how much that reproductive number is above 1. If it's above 1, it means the pandemic is growing. The number of people that come from one person testing positive is more than 1. If it's below 1, that's encouraging. It means we're stopping that transmission going forward. I do look at the wastewater, and I was, more concerned last week than this week, actually, when it comes to the wastewater, because now we've seen it stop that rapid rise. It turned sideways. We'll watch that some more. And the other encouraging news I had today about the wastewater was that we have not detected the variant of concern in the wastewater sample process from March 9th, whereas we did detect the variant of concern on March 2nd. So that is also something to keep an eye on.
Thank you.
Thank you very much. Moving on, we will go to Ted Raymond at CTV Ottawa.
Hi there. This question is for Dr. Etches. Just kind of following up on some of that. Maybe you, with the nice weather here today and tomorrow, St. Paddy's Day coming up, could you just kind of go over some of your recommendations for what people can and should do safely to sort of celebrate not being in the cold so much while we're in Orange?
Please go outside, absolutely, and visit people outside, keeping in mind that even outside there can be COVID transmission when you're close to people or when you're in a crowded situation. So still using that 2-meter distance buffer is useful and will stop more COVID transmission. And if you're in a crowded environment outside, it doesn't hurt to wear the mask. It keeps another barrier between you and others. If you have an asymptomatic COVID infection, then it will be less likely to be passed on. Someone else has it, there's some protection. So these are the core behaviors we need to keep going for a number of months. Distance and masking, being outside is excellent. It is better than being indoors.
Okay, thank you. As a follow-up question, I guess, to Mr. DeMonte, we had the note from the city today about the phone lines for the vaccine booking system getting a little overwhelmed or experiencing pretty high volumes. Is there anything in place to maybe rectify that on your end, or is it mostly just a case of the city kind of reiterating that you should only call if you've gone through the eligibility screening?
Yeah, so thank you for that question. I mean, it is clear we all want this vaccine. So my first comment is to tell everybody that is now in the eligibility category, they will get their vaccine. So those are 90 over. If you're calling for somebody 90 and over, please be patient with us. I would want to remind everybody when we said this, instead of waiting for the March 15th for the provincial booking system to be up and running, we made a decision here, and we knew it would be perhaps a little more difficult because it's just a phone line to nonetheless open up to the next category, because we want to get these vaccines into the most vulnerable, which is our next category of individuals. So we knew there's a bit of a risk. But directly to your question, yeah, we have noticed this morning and the onslaught of the first day, which is kind of normal, and we expected that. We're maxed out. We have all the tools that we need and the staff there. The challenge we are seeing, though, and I just want to reiterate it, if you're a healthcare worker in the next category, please go to ottawapublichealth.ca and go online to do your registration. We have many of those calls coming in, so that takes some time away. And as well, if for eligibility, I just want to repeat, if you're 90 and over, sure, you can call the line, but we're getting a lot of people still calling that aren't in the eligibility category, and that would be helpful. And what it is, and I understand people want the vaccine, but what that does is it does tie up lines for those who are eligible this time. So I would suspect in the next day or so, things will adapt and adjust, but those are two key messages I'd like to get out there. And again, reiterate, everybody, when you do get on, you will get a vaccine if you're in the category. Please don't worry about that.
Thank you very much. We will now be going to Craig Lord at Global Ottawa.
Hi there. This is a question kind of around St. Patrick's Day. We're about a year almost now into the pandemic, and I feel like there's a tension that has never really been resolved. And it comes down to, I think, what Councillor Keith Eglai was saying at the end of council, which was encouraging people to go out and celebrate in bars and restaurants, and also saying that we see spikes in COVID tied to social events. So I'm just looking to hear from Mayor Jim Watson and also from Dr. Etches is how are people supposed to reconcile those two sentiments of support businesses and enjoy things safely, but also social events will lead to spikes in COVID?
Well, I'll ask Dr. Etches to offer her comment, and I thank Councillor Eglai, who I think is on the line as well, who spoke about this at the council meeting, Craig. It's really trying to find that balance. We know, for instance, that the rules under the orange category keep a maximum of 50 people in a facility, but that's dependent on how big the facility is. If it's very small and you can't have the 2-meter distance between tables, and that people have to stick to their tables as opposed to wandering around. So we're asking for the best of our public to be respectful of the fact that this is probably not the year to go and party or to have a party at your own home. Save up that energy and save up that Guinness for 2022. That's our best advice. Obviously, there will be people that will be coming down to bars, but we're going to have enhanced enforcement to make sure that the numbers are respected in each category. Dr. Etches?
Yes, and I do want to thank the businesses. So the important thing is that when businesses are open, they're putting in these layers of protection. They're making sure that their workers are screened and not coming to work sick. They're making that they do set up the environment so that there can be distance between people, and wearing masks. The responsibility definitely comes to the patrons, where you'll have less risk of transmission if you stick to members of your household in close contact at tables. That is important rather than mixing multiple households together. Also, we know that it is possible to support businesses by doing takeout, and that is lower risk. So I think some things are permissible and they're higher risk, and we can keep choosing the lower risk options that support businesses by using these other options available to us. Certainly, I think the things I said earlier are important as well, that if you can be outdoors at a business, that also makes a difference. So I think that you can't go wrong when you follow the basic principles of limiting your contacts, keep distance between others, and wear a mask as much as possible indoors or if in crowded situations.
Thanks very much for that. Just a quick follow-up, I think, to Anthony DeMonte, probably just wondering what is Bylaw's approach going to be like on St. Patrick's Day?
Thank you. I think Dr. Etches and the mayor set the table well. It's not time for us now to get into trouble. We're very close to the next level of red, so we don't want to go there. Bylaw and Regulatory Services will be staffed up significantly over that period, and will be intervening based on complaints and taking appropriate action where necessary. The officers have full discretion, but I think you can see from my tone that it's not time to turn things around. We've had other circumstances where we've had long weekends and that, and we've always seen spikes. It's really not time to do that. We're too close to the red. We don't want to go there. So we'll be playing our part. But as I've often said, enforcement is a tool. It's up to each and every one of us to follow Dr. Etches and Public Health's advice.
Thank you.
Thank you, Craig. Nous allons maintenant passer à Julien Paquette.
We'll give the floor to Julien Paquette from Le Droit. Hello. We had a motion that was adopted today about lodging. It was to ask the province permission to receive the authority for supplemental allocation for emergency lodging. Were you able to follow the criteria as applied for that program or that initiative up to now? Julien, this is a question for Donna Gray. She doesn't speak French. There's no translation for her. Okay, I will repeat the question in English.
I was asking about the motion regarding the housing blitz and the request to the province to use money for emergency housing and to transfer it for supplement. I was trying to clarify if there has been a precedent observed for this kind of request. Has the province ever agreed to do this kind of thing?
Donna, it's Saeed here. I can help with that.
Yeah, and I think Paul can do the French component of it too. Go ahead, Saeed.
All right, thank you. We've made similar requests to the province before, and they have. With this particular one, it's a little bit trickier because it does involve a program with both the provincial and federal government, but it's usually negotiated between the provincial government with the federal government before it's provided to the city. So we'll make this request, and we're hopeful that it could work.
Okay. The follow-up question I had on that is, would that be only for the remaining of 2021, this rent supplement, or how would we find a way to extend this rent supplement? Because I guess if people are getting a new home with the help of this help, they will need it past December 31st. So how would we then make sure that they still get this rent supplement in the following years?
Yep, thank you. We actually do have rent supplements at this level of funding already with the city and with the provincial and federal government. So we'll ask them to equalize the programs. And if they do accept, then it would go on, not in perpetuity, but for the length of the agreement. So it would go on beyond 2021.
Okay, great. Thank you very much.
Merci beaucoup, Julien. We will now be going to John Willing at the Ottawa Citizen.
Thanks, Kina. Mayor Watson, just jumping off Kate's question about the notion of a Trillium Line delay, I'm just wondering if you were told between mid-January in your most recent FEDCO briefing that Transit Next had submitted a notice of delay speaking to a delay of 160 days on the Trillium Line project.
No, as I mentioned to Kate, it was, I guess, a couple of days before the joint committee meeting, and was informed that we're looking at 45-day delay, but that we need more time as a result of bringing in an independent consultant that could actually determine what the actual delay is going to be and come closer to a more realistic number than I had seen, which was the 40-day, I think, number prior to the in-camera meeting. Thank you.
Thanks, Mayor. A question about the status of permitting for special events. Is it too early to start talking about if we're going to have special event permits for festivals and such this summer, or when will that decision be made?
So I can perhaps help John with that. We're monitoring closely, and we've all been discussing our borderline from orange to red. So it certainly it'll depend what status we are in as a city when that season comes. But what we're doing as a city globally with all our partners is we want to be postured to be ready if we are able to have events in spite of whatever the regulations will be in place, to have those events, to try to get some semblancy back of normalcy into our community and help our special events community. But that said, I had an earlier comment. There was comments about Canada's Wonderland opening. I remind everybody, and Dr. Etches could give us a more scientific explanation. We'll likely have one dose of vaccine into a lot of people as we get closer to summer, but that doesn't mean we're completely vaccinated. So I think a lot of the rules that'll still be required may put a bit of a cold shower on a lot of the big events. But I guess what I'm telling you is we're going to be very, very flexible to try to lean towards having events as long as they can be done safely and within the public health rules.
Okay, thanks, Mr. Demonte.
Thank you, John. We will now be going to Bruce Deachman at Ottawa Sun. Bruce, are you on the line? Okay, Bruce, it appears we can't hear you. If you could just please liaise with Media Relations if you have any questions. Nous allons maintenant... Oh, are you there, Bruce?
Can you hear me?
Yes, now we can hear you.
Oh, sorry, I was having trouble going off mute, and I was only wanted to say my questions have already been asked and answered, so I'm good, thanks.
Thank you very much. Nous allons maintenant passer à Nafi.
We'll give the floor now to Nafi Alibert from Radio-Canada. Hello? I would like to go back to the online scheduling for the 19 years old and up. It looks that your phone system or call center is submerged with calls. Can we use the family doctors for vaccinations? Thank you for your question. Like I said earlier, normally we should have waited till March 15 to use the online reservation system from the province of Ontario. Though we had some doses available, we have a new category now with 90 years and older. This is a population that we need to vaccinate as soon as possible. Dr. Etches was clear. This population is vulnerable. So we decided to open our call center. We have about 6,000, we can vaccinate up to 6,000 people. Today, with the first day, it's normal. People want to schedule their vaccination. Right now, we're submerged. It will ease up in the following days. Don't be worried. You will be vaccinated. Just be patient. We have the doses. We're ready to vaccinate you. And this population is high priority. What we see today are two things. The next group that will be vaccinated is already calling. So we're asking you not to call for right now, only people aged 90 years and over. On the website of Public Health Ottawa, we have also a contact system there. This will reduce the number of calls. But if you're not eligible right now, please do not call in. Just be patient. Leave the lines to the target population of 90 years and over. We have enough doses. We will move to the second group as soon as we have vaccines available. So you don't have a website for the 90 years old and over. No, we're waiting for March 15. We will be using the Ontario provincial system. It was a decision, but we thought that this group was a high risk and we would use our phoning system. In Quebec, they're vaccinating the 70 years old and older. We had the impression that Ottawa was moving faster than the rest of the province last week. Exactly. We are before other cities in the province of Ontario. What you're doing is you're comparing Ontario to Quebec. The process is different. I don't want to put Dr. Etches on the spot. Maybe she's the best person to answer your question. It's very difficult to compare us to Quebec. Right now, they're at the different stage. In Ontario, we're still focusing on the 90 years and older. Dr. Etch, would you want to complement my answer? I would say that we have different situations throughout the province of Ontario. It depends on the number of doses available. We want to be able to offer the vaccine to the population aged 90 years and older. The difference for us here in Ottawa is we're using those doses for the high-risk population. That's the way we decided to move forward in Ottawa. Thank you very much, Nafi. Do you have a follow-up question? That was it. Thank you very much.
To Sue Sharing on the City from the Burbs.
Thanks very much.
Mayor Watson, at today's meeting, you seemed very reluctant to tell the citizens of Ottawa what's going on with LRT. Am I misreading that?
My apologies, Sue. The mayor had to leave. Would you like to direct your question to someone else?
Well, it's kind of hard to because it was the mayor who seemed reluctant. So,
my apologies.
I mean, perhaps John Manconi or Steve could comment on it about why the citizens of Ottawa aren't being made more informed about what's going on.
Hi, Sue. It's Steve Kanelakis.
I know.
Just in case you forgot what my voice sounds like.
Never.
Yeah, well, first of all, the mayor made a ruling that the item wasn't on the agenda, so it was a question that was raised about that. So that's a procedural issue. We had brief counsel on the schedule, and what we believed was the delay in the schedule was 40 days, but we also told council that we still had several months of work with our world-class expert, third-party expert we hired, who are scheduling experts, who are going to be looking at this over the next couple months to give council a definitive response in terms of what the schedule looks like, and we'll probably be able to do that in May is what we're hoping. And so any day, you know, a day was reported in terms of what the TNext reported to us. And, you know, those are built full of assumptions, and they're tied up with a whole bunch of commercial issues in terms of what they put in the schedule. And until we validate what that schedule delay is, we're not coming back to council and just throwing around dates without any validation or any ability to say to council, we have looked at it independently, and this is what the delay is for the schedule. And that's what council is going to hear. So it's not a question of not providing information to council. We'll provide the accurate information to council when we have it. Throwing out days because someone tells us a day in the past is not relevant when that day is wrong. And in terms of the date, the 116 days is not right.
Okay. My second question is to media. When did the mayor leave?
I believe it was about 5 to 10 minutes ago.
So it wasn't right before my question.
Sorry, Sue, I didn't hear that. My apologies. This is all the time that we have today. C'est tout le temps que nous disposons aujourd'hui. Thank you very much. Merci beaucoup.
Pieces of